Vaccines are believed to be the last hope for eradicating vaccine-preventable diseases. According to the World Health Organization, it is estimated to save about 4 to 5 million lives yearly. Unfortunately, this life-saving tool is underutilized. Today on Sound Health, we are taking a look at how to scale up immunization in Nigeria. Good evening, I am Olasumbo Modupe. The conversation begins after this break. Please stay tuned.
In July last year, I declared a public health emergency of international concern over the multi-country outbreak of Mpox as the virus spread rapidly across the world. WHO has been very encouraged by the rapid response of countries. We now see steady progress in controlling the outbreak based on the lessons of HIV and working closely with the most affected communities. Almost 90% fewer cases were reported in the past 3 months compared with the previous 3 months. Yesterday, the Emergency Committee for Mpox met and recommended to me that the multi-country outbreak of Mpox no longer represents a public health emergency of international concern. I have accepted that advice, and I am pleased to declare that the Mpox is no longer a global health emergency. While we welcome the downward trend of Mpox cases globally, the virus continues to affect communities in all regions, including in Africa, where transmission is still not well understood. It remains important for countries to maintain their testing capacities and to continue their efforts, assess their risk, quantify their needs to respond, and act promptly when needed.
Thanks for staying with us. The program is still Sound Health on Lagos Television. Joining us via Zoom this evening is Dr. Ijeoma Agbo, UNICEF Health Specialist, and she's going to share her expertise on how to scale up immunization in Nigeria. Good evening, Dr. Agbo. Thanks for joining us.
Good evening. Thanks for having me.
All right. We all know the importance of routine immunization. Tell us, where are we in terms of the vaccination drive and immunization generally in Nigeria?
So, just as you mentioned, immunization efforts have been going on worldwide. We all know that vaccines are the greatest advances that we have in global health and development. But in the last couple of years, we've seen a decline in our immunization coverage, which came about due to the pandemic. And so UNICEF, along with government partners and the private sector, is supporting the government to scale up immunization so that we can regain all the gains that we had previously in immunization and ensure that we have a community and society that is protected.
Okay, all right. According to the multiple cluster indicator that was released in 2021, Mixes 6, 36% of Nigerian children are fully vaccinated, while 46% are partially vaccinated and 18% are not vaccinated at all. What's your take on these data released by Mixes 6 in 2021?
So yeah, thanks very much. Yes, you've quoted the data. This is the findings, and we all know that with the pandemic, we really regressed as a country. But this is not. This is the data just shows some areas that we need to work on, and immunization is one of those key areas. We find that across the country we have varying immunization coverage. We have certain parts of the country performing better and some performing poorer. But what we're looking at now is to target the unimmunized as well as the zero dose. Zero dose are those that have not even gotten vaccinated at all. And there are lots of efforts going into that right now. And it's a multi-pronged approach, running from service delivery down to ensuring that we have vaccines available to the last mile, and also ensuring that we are labeling this information. So it's a multi-pronged approach that we're taking right now in the country.
All right. What are the consequences? Are there implications for not being vaccinated?
So definitely there are consequences. There are consequences for the individual and the child. So we're seeing that, of course, children will come down with vaccine-preventable diseases, for instance, measles. Also, in the last couple of months, we've also seen that we've had diphtheria outbreaks across the country, including Lagos. Um, and so those are the implications. Of course, we have children who are out of school, they don't grow optimally, they are not able to learn because they're out of school. Also, for the economy at large, you have the parents having to leave work to take their children to the hospital and all that. So it has a lot of deterrence of effects on the society.
Okay, this life-saving tool is underutilized. Many people still believe there is no need for vaccination or vaccines. How are you handling vaccine mistrust, misinformation, and some myth, especially conspiracy theories? We keep having disease outbreak. We keep having innovation of new vaccines. The most recent being the malaria vaccines. How are you handling this, aside use of campaigns?
Okay, so thanks very much. So vaccine hesitancy has been one of the major threats that we have to public health. This has all that vaccination itself, to be honest. And so we've had that, of course, disinformation is a key driver on the vaccination within Nigeria. So we're working very, very closely with our communities to ensure that we disseminate accurate information and allay the spread of misinformation. And this is quite essential to ensure that communities can achieve their children to get vaccinated. So we work very keenly with communities. Community engagement is really, really important, and as well as data and facts to ensure that we have fact-based information on vaccination and implementation. And that is one of the things that the mix was really good with, because it brought out real-life information on what exactly was happening in our immunization program. And so we work with the government, we work with communities, we work with civil society organizations, as well as faith-based organizations to continue to increase our awareness, not just just everywhere, but also look at a lot of our understanding and which area, and work very keenly with these communities. And publicity that are very important, and traditionally that are very important, as well as our religious-based leaders. So we work very closely with them to ensure that the right information gets down to caregivers within the communities.
All right, now let's look at COVID-19 vaccination. Has the country been able to meet the targets set by the National Primary Health Care Development Board?
Within the country, if you look at different states, we have some states that have performed much better than others. But countrywide, we haven't reached the specified 70% that the MKCD had hoped to reach 2022 December. But efforts are still ongoing. One thing that is clear is that we need to integrate COVID vaccination into the routine vaccination program. It cannot be a standalone program, and that is one thing that is being done, and one thing that UNICEF is pushing for, that it is integrated into the routine immunization program. So once a caregiver comes with their child to get vaccinated, one thing we ensure is the mother and the father vaccinated as well against COVID-19. And then we're working very closely with our community leaders, as I mentioned earlier, to ensure that we continue to get the right messaging around COVID-19 vaccines to our communities, just to ensure that everyone is protected.
All right, a quick one now. Are kids or children being vaccinated for COVID-19 now?
In Nigeria, it's in
yes, in Nigeria.
Is the age that you need to be to get vaccinated against COVID-19. So it's still at 18 and above.
Okay, how do we catch up with the vacuum created by COVID-19 pandemic? Do you see Nigeria meeting up real soon?
Definitely. If you look at, we just had our World Immunization Week, and the theme of the week was the big catch-up. And it targeted global effort to boost vaccination amongst children following the declines that we had, and that was driven by the COVID pandemic. And so with this theme, the messaging is out there to ensure that we start to catch up, build up, and restore immunization program. We have a lot of focus, as I mentioned earlier, on our zero dose and immunized. And so a lot of effort and strategizing on how to ensure that we build up our immunization and we reach pre-pandemic coverage numbers. So there's a lot of work going on. We'd like to commend the government. We're doing a lot to ensure that we get back to pre-pandemic and even surpass that.
Okay, I know the World Health Organization has just declared that some diseases like the monkeypox and COVID-19 are no longer a public health concern. Now, what message do you have for members of the public in terms of continuous vaccination? I know vaccination is still ongoing. Do you advise the public to go ahead with vaccination, or should we just relax and let our guards down?
Definitely we can't do that. Whilst yes, they have declared that monkeypox, COVID vaccinations, COVID-19 is no more of a
public health concern,
international concern. We cannot say that. We cannot regress, because if we relax, you never know, we might have spikes again coming up, and then we're back to square one. So definitely we need to sustain the gains that we made and even surpass that. And just as I mentioned, that is why the government is looking at integrating COVID vaccination into routine immunization. Everything we're doing now, once we're talking about routine immunization, we're also talking about COVID vaccination, we're talking about other PAT services that are important to ensure that everyone, the community, remains healthy. Of course, when you have a healthy community, that way we can thrive and we can have economic development within the country. So definitely we've come a long way in vaccination, but we still have a lot to do in this regard.
All right, the malaria vaccine has been introduced in some African countries. Nigeria soon will roll out these vaccines. What step do you think can be adopted to integrate this vaccine to the routine immunization? We don't know if it's going to be part of the routine immunization for children. What step do you think should be adopted or put in place?
We're going to continue to see new vaccines, being introduced to prevent diseases. Malaria vaccine, I know once in the country, it's been introduced. We have programs that are being implemented once new vaccines are being introduced to ensure that it is accepted within the communities, because for the good of the communities, right? But apart from the malaria vaccine, we also have the human papillomavirus vaccine that is going to be introduced to adolescents by the end of this year to prevent cervical cancer. So there are a lot of advances that are being introduced, and definitely once it comes in country, it's a multiple approach from getting information out, building trust for the vaccine. We use data to push this out, and of course working with our communities. So we'll do all we can as the UNICEF supporting the government to address whatever information might be out there, and for it to work with them to ensure that vaccines are being accepted, because it's for the good of our children and communities at large.
All right, Dr. Agbo, before I let you go now, what is your call to action?
So, this is an historic opportunity for us to set out a pathway for the eradication of preventable diseases amongst our children and adolescents. But we require a collective effort to scale up immunization. And when I mean collective effort, it also includes the media. And thank you so much for this interview and all that you're doing. We definitely need a collective effort to reach every child and every community with vaccines and health services. And we have confidence in the life-saving power of vaccines, but we can't do it alone. We need everyone. We continue to push out the information that they should trust vaccines. It's the only way we can prevent diseases in our children. And as UNICEF will continue to support the government in ensuring that they have an immunization program that is effectively run to ensure that potent vaccines are reached even at the last minute. Thank you.
All right, we definitely need collective effort to scale up immunization. Dr. Ijeoma Agbo, UNICEF Health Specialist, thank you so much for your time and expertise on sound health.
Thank you very much for having me.
All right, Sound Health continues with trending health report from around the world. Please stay tuned. All right, this is where we say thank you on today's episode of Sound Health. Hope you've learned one or two things about vaccines and the need to scale up immunization. Vaccines are safe and harmless, required for preventable diseases. Get vaccinated today. For comments and inquiries, or you have topics you would like us to treat, send SMS to 0035826603 or follow us on social media at LTV Social, #Sound Health. A sound health is a sound mind. Make healthy living your choice.